Everyone wants to believe it sort of like happens simply and quickly, and I think that unless it's your good friends, you don't really share that sort of information.
I'm 28 years old and I'm very interested in having kids.
I am 30 years old.
I'm 33.
I am 34.
I'm 45 years old.
And all of a sudden you realize it's a whole lot harder than you think it's going to be.
You hope that things will happen and take its course and things will fall into place.
I get a little nervous just thinking about it. It seems like kind of a scary place.
There's so much involved. Not only are you having fertility issues, but you're trying to do something about it.
As far as I've been informed, age and health are very important.
It becomes difficult to get pregnant probably around 40.
45?
37, 38.
Probably in your later 30s to 40s.
I've heard that, your best fertility time is in your 20s, but it's kind of hard to do that with a career.
There were more important things in our lives than starting a family, like establishing ourselves financially.
Yeah, I don't know a whole lot, honestly, about other fertility treatments.
If I had to guess how much fertility treatments cost, I have no idea.
I actually don't even know what doctor you see for that. I don't know if I would just go to my gynecologist and ask about it.
I don't really know what a reproductive endocrinologist is.
There are over 7 million infertile couples in the United States, and it's amazing how few actually come in and begin treatment. I'm Alan Copperman. I'm a reproductive endocrinologist. A reproductive endocrinologist is an obstetrician gynecologist who's trained for an additional 3 years in the specialty of reproductive endocrinology and infertility. We can learn a lot of information just by talking to a patient. Are the eggs okay? Is the uterus normal? Are the sperm okay? Is the timing right? But ultimately, doing an ultrasound will tell us about the structure of the anatomy, and doing some blood tests will tell us whether she's healthy, whether her eggs are healthy, and what her ovarian age is. After those very basic tests, we can almost always figure out what's wrong. It could be as simple as finding the right time for a couple to have intercourse. There are fertility pills, fertility shots, or even an insemination where we process the sperm and put it right into the uterus. Sometimes it takes processes such as in vitro fertilization. In vitro fertilization involves giving fertility medications, and then we retrieve the eggs in a very brief procedure. That afternoon, the eggs are fertilized, and several days later, the best embryos are transferred back into the uterus. Today, it is incredible how precise we can be with the diagnosis and the treatment of infertility. I think that couples are afraid that the first visit is going to be scary, or they're going to find out things that'll suggest that they're never going to have a baby.
You kind of see some of those anxieties alleviate because there is a plan of care set in place. So initially when the patients come in, you'll walk in the fertility clinic and you'll be greeted by the patient services coordinator, and then you're going to meet with your physician. They'll go over physical, they'll go over an initial assessment, and then the nurse will describe the testing and the diagnostic tests that are available. And then you have a whole team behind you, which includes your nurses, your phlebotomy team, and your complementary care team. And there are financial options available for couples out there. So make sure when you actually do come to a fertility center that you meet with their financial team to understand what is available to you.
Whether you're a same-sex couple, a couple who's been married for years, single mother by choice, or a woman who wants to preserve her fertility, every patient who walks in the door has the same goal: to have a family of their own. Each patient's experience with fertility treatments is unique and may differ from the stories presented in this video. Patients should consult with their healthcare provider to discuss if fertility treatments would be appropriate for them.
When I was in my early 20s, I would say that I would be married with a few kids, by the time I was in my 30s. It wasn't really until I hit my mid-30s that I realized, maybe I want to settle down. When I did meet the man who would become my future husband, we fell in love, and of course we knew that we wanted to have a family right away. One day we went to my OBGYN. We were in the chair and my husband was holding my hand, and we were just like kind of two expectant parents. We saw the technician. She sits down and she says, I'm really sorry to inform you, but we're not hearing the fetal heartbeat. You envision that, everything's going to be perfect and you won't have to struggle. And unfortunately, that's not always the hand that you're dealt, so. We had 2 pregnancy losses within 2 years, and then there was a 3rd pregnancy loss. It blindsided us a little bit, we're having trouble having children and we need to go see a specialist. And what does that mean for us? We made an appointment with this reproductive endocrinologist, and you need to have a sense of, I'm putting my hopes and dreams in this person's hands. We felt very comfortable and very safe, which I think is really important. Our goal was to try and get pregnant, and that's kind of what we focused on, was like the bigger picture. We've switched reproductive endocrinologists 2 times, and each time we kept thinking, okay, maybe this person can help us, and if not, who can help us achieve our goal? And when IUI failed several times, that was when we kind of again moved on to the big leagues of IVF. I ended up getting pregnant. It was definitely worth it. I mean, I'm gonna start to tear up probably, because we love our daughter to pieces. She's the best thing that ever happened to us. And when you think of 5 years ago, when my husband and I thought we would never have a family, it is pretty emotional.
I was the type of child that my whole life revolved around having children, and it was like I couldn't wait until I was old enough. So I figured by 25, 26, I would probably be married and ready to have children. And I remember asking my doctor, when I was a teenager, I had irregular cycles. Do you think this is something that is going to return when I get to the point where I'm ready to have children? And she said, worry about it when the time comes. And then we got married, we got a house, and the next thing was, okay, it's time to have kids. And of course, the same thing happened when we decided we were ready. From the time that we started trying until the time that I went to the specialist was probably about a 8-month period, I would say. And when it's not happening and you're watching everyone around you get pregnant, and I was depressed and lonely, and we did everything right. Why does this have to be a problem now? I think there's a lot of shame in infertility. It's almost like embarrassing. This is something that's supposed to happen naturally. And it was through looking on the internet and finding others who had the same hormonal disorder that I had. I saw this term reproductive endocrinologist, and I started researching more about that, and it just seemed perfect. The woman that greeted you at the front desk had the biggest smile on her face. She was just, happy to see you there. I just felt walking into that office that I was at a place where people wanted to help me. They were going to help me. Our doctor recommended starting off with treatments, which we did. We did the same treatment for a couple of months, and that didn't work. And then we tried a different treatment, and that didn't work. And then finally, she recommended trying in vitro fertilization, which had the best odds of working. We were fortunate enough for it to work, and we ended up with 2 beautiful, happy, healthy twins. I just feel grateful about the whole process. It was something that I wanted for so long, and as soon as I knew that there was something that could be done immediately, I didn't hesitate at all.
There are so many old wives' tales about fertility treatments. We're here to demystify all of that.
How do I know if I need to see a specialist?
So if the couple's been trying to get pregnant for a year, it's time to get some help. And if a woman's over the age of 35 and trying to get pregnant, 6 months is more than enough time before she goes and seeks some help.
I'm 31. Is that too old to have a baby?
Absolutely not. Women who are 26, 36, and even 46 can get pregnant. Usually when a woman is over 44 or 45, we have to discuss other options, up to and including donor egg. But a 36-year-old has a lot of normal eggs generally, and often very quickly conceives.
Do I have to bring my husband or boyfriend with me to the appointment?
Whenever possible, we like to see both partners come in for the first consultation, because infertility ultimately is a couple's problem.
What are some myths about fertility?
One common old wives' tale is that drinking a lot of cough syrup is good because it could thin the cervical mucus, making it easier for the sperm to pass through. It turns out that that really has no basis in truth. The whole boxers versus briefs is a question that's been asked for years. It turns out that probably doesn't matter. But if a guy is spending hours and hours in a hot tub, then that will elevate the temperature of his testicles, and it may impair sperm formation.
What are the risks associated with fertility treatments?
Possible side effects of fertility treatment and fertility medications may include mild cramping and or abdominal pain, mild bruising and soreness at the medication site, nausea, breast tenderness and increased vaginal discharge, mood swings and fatigue, and ovarian hyperstimulation syndrome, or OHSS. OHSS involves sudden ovarian enlargement accompanied by fluid accumulation in the abdominal cavity. This may occur with or without pain and with or without accumulation of fluid in the lungs. OHSS is caused when the ovaries become overstimulated by the various hormones that cause follicular development. Your doctor will monitor you frequently to help address these risks. Thank you for taking this tour with us today. Hopefully you've learned a little bit about what your first visit will be like to a fertility center. You'll become empowered to ask the right questions, and once you take your first step, hopefully success will soon come your way. For more information, please visit fertilitylifelines.com.